congregation. The apostle, same thing. The teacher, same thing, as well as the 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 prophet, the apostles, the pastors, the teachers, and yes. So the four, as in the teacher, the apostle, the prophet, and the evangelist, they can sit under the pastor. The pastor is an
now, you gotta tell them about the event because we're on the doctor's time. So you gotta let them know about the special event coming up.
Oh, okay. I'm sorry for that. Come Saturday, 7 p.m. The 9th of March, we'll be gathered at Milton and East Street at a church called the Voice of the Watchman, where Apostle Lyons is the head of that house. And so we would be receiving ministries from each of the gifts. And there is the invitation to bring along your loved ones, and also the invitation to encourage all pastors because they have the flock under them. And so 7 p.m. we start on the 9th of March at Voice of the Watchman, whereby we're expecting a powerful move of God as the body of Christ is charged to return to having his demand, which is to have these gifts functioning in his body unto his honor and his glory. Thank you.
Thank you, Apostle. I appreciate that. And today, we just want to let you know there's a special event taking place. My guest will tell you more about it. I can speak from experience. I got my foot examined, and I'm inviting you to do likewise. They have a number of free clinics. And so if you're listening, you're listening. Who those of you who are watching on Facebook and also on YouTube later, pass the information down. My guest today, Dr. Monique Mitchell and Nurse Raming. I'm going to introduce Dr. Mitchell. She's going to share Nurse Raming, and then my co-host, Jackie Gardner, she will take it from there because she has a number of questions she may want to ask. And if not, then I will kick in and I will ask the questions. Dr. Monique Mitchell, just want to welcome you to the program, Transforming Lives.
Good evening. Good afternoon, everyone. Thank you.
Nurse Raming.
Good evening. My name is Lindiana Raming. I'm the president of the Bahamas Diabetes Educators Association and Bahamas Diabetic Association, and the lead for hypertension and diabetes in our country on Healthy Bahamas Coalition. Good evening. It's a pleasure to be here.
Okay, just want to say thanks. So Dr. Mitchell going to tell you what was happening here now at the family clinic.
Good afternoon, everyone. I'm sure you can hear my voice is a little off today, but this is me. So today we're here at Family Foot Center, and we're here talking about the Foot Fest 24. The Ministry of Health and Barry University is hosting the Foot Fest for the third time, actually. And it's going on from today, the 3rd of March, straight to the 8th of March. And we're very excited, very busy here today. Started at 12 o'clock sharp. And we've had hundreds, I guess almost 100 persons here today who have had their feet checked like Dave did.
Yes.
And we also have persons signing up for surgery, and they're having health screening as well. And so it's very, very exciting. We have about 54 persons from the United States, a team from Barry University, and other podiatric medical programs in the United States who are here. They will be here for the entire week. And we will actually continue. And we are actually having clinics today at South Beach as well, and at Foot and Ankle International. So if you haven't been seen yet, it may be a little bit too late for today, but you may have opportunities throughout the week. We will continue to have clinics at South Beach Clinic, Elizabeth Estate, Fleming Street, and Flamingo Gardens Clinic every day of the week. Most of the clinics are in the afternoon. Fleming Street starts at 1 p.m., South Beach starts at 12, and Elizabeth Estate and Flamingo Gardens start at 2 p.m. So you can actually call any of those clinics to make an appointment so that you can have your feet checked, or you can also call our cell phone number, which is 827-3338. And we just want to encourage persons to come out. If you have diabetes, if you have any foot pain, or you have any challenges with your feet, this is your opportunity to have your feet examined for free. Yes, I said free. FREE. So come on down and have your feet checked. I'm going to have Nurse Rami continue and tell you a little bit more about what we're doing here and how we're linked with Diabetes Association and why it's important for our diabetics to be here.
Yeah, this is a blessing. Diabetics, one of the complications is poor circulation in the feet, deformity, amputations. Listen, please come out. We are partnering with them. We are so happy to have this opportunity. So seize the opportunity and come out at any of the government clinics. Come and register. And along with that, diabetics, we are trying to increase our membership. We want you to register with the Bahamas Diabetic Association so we can pass the blessings on to you. You need to come. As diabetics, you're supposed to make sure, check your feet every day. And if you cannot assess your foot properly, come and get the free training by specialists here. In our country, there's only 4 podiatrists in our country. Come and seize the moment and get it done. Get your feet checked properly by professionals. If you have numbness in your feet, tingling, swelling, deformities of the foot, the toes, bunions, sores, cuts that are not healing well, that's complication of diabetes and poor sugar control. So please come and be seen by the professional. Take this time out for you. Only you can do this for you. So come on down. You have the whole week, every government clinic in Nassau. You have of them, South Beach Clinic, like Doc say, Elizabeth Estate, Fleming Street, Flamingo Gardens. Come and be seen. We'll be there to assist you. They have persons to assess you, registration. We're going to be there to help you and to help educate you also. So come and be blessed.
I also want to mention that we will actually be in Freeport on Wednesday, on the 6th of March. We will actually be in Freeport, and we'll also be seeing persons at 3 clinics there. That's 8 Mile Rock Clinic, High Rock Clinic, and Hawksbill Clinic. So persons in Freeport, if you're watching or listening, you can actually also go to one of those clinics and have your feet seen. This time we're also going to geriatrics. We did this last year as well, and it was really a pleasure for us to take care of our elderly persons who are in geriatrics hospital, to have their feet examined and to have their taking care of their feet as well. So we want to do our best. Today we saw quite a bit of children as well. So we're seeing persons from all ages, from the cradle to the grave, like say. So very young and very old. So we are invite persons to come on down, come out and have their feet checked. And it's all not only about the feet check. We want to make sure persons are getting educated about how to better take care of their feet. For the first time, we are actually doing surgery. So persons are in the midst of getting their surgery evaluations done, and they're being scheduled for surgery for tomorrow, for Monday and Tuesday. So we're very, very pleased about that, because we have persons who had these deformities for years and never had the opportunity to have them fixed. And so now they're able to get them fixed. So we're very, very happy about that.
Thank you, Doc. Thank you, nurse. Jackie, how are you? I know your voice is not well, but just want to bring you in if you could talk.
Hi, of course, I'm in the background. I'm somewhat like Dr. Monique, but the voice compromised. It's good to hear, despite the condition of her voice, she's doing her very best to bring prevalent much needed information to the Bahamas. And so I want to encourage, first I want to say happy Sunday to everyone. It is indeed an honor and an opportunity once again to be on Transforming Lives, because we never take this for granted. Just within the week, I experienced two, young persons in their 50s, sorry, the passing of two young persons that I grew up in my childhood. And it tells you, how fragile life is. And so to see we have persons on the air offering pertinent information and services free, and she spelt that free, Free, free of charge to the people of the Bahamas. I want to encourage one and all to please take advantage of the service. I think I have one question, and then I'm going to turn it over to you. I'm going to start off with my first question. Just bear with me a second, please.
Okay. Right, and while you get the question, you come in anytime. I just want to let the persons know. So we were down here from 12 o'clock. There were many, many persons, like the doc said. And as a matter of fact, persons are actually still here. But they're not taking any new persons, only those who have an appointment. So they're only taking those individuals who have an appointment to come and have their feet examined. And so we just want to encourage you to be a part of the program. I am vocal about it. I'm letting you know open that I came earlier last year. I too was diagnosed as pre-diabetic, diabetic, whatever. And so it caused me to be conscious of my lifestyle. After I've said it before, after 20 years plus years of no meat eating and no sodas and all of that. And so I got the shock of my life when I got it, when they told me my A1C was, I think, 7 point something, whatever it is. But nevertheless, it is what it is. And so the only thing I can do is just do what need to be done. Last week Sunday, this time I was rejoicing. Last week I was celebrating 59 years old, Amen. To God be the glory, you know what I mean? And so for the next 59 years, I want to be happy and healthy and whole. And, I want to be able to walk around with nobody got to take me around. And, so we got to take care of ourselves. And like I say,
absolutely.
Go ahead. You got you ready, Jackie? Your question? Go ahead.
No, I had my questions, but I was celebrating with you. Happy birthday once again. And I totally agree with you. So I just want to ask this question. How does diabetes impact nerve function and circulation in the feet? And what signs should individuals watch out for? So I'll ask the question again. How does diabetes impact nerve function and circulation in the feet? And what signs should individuals watch out for?
Okay. Sorry, that is an excellent question. We know that persistent high blood sugar, that's high blood sugar over time, actually damages the nerves. And this can actually happen, Jackie, before you actually are diagnosed with diabetes. So a lot of persons end up with neuropathy. That's what the condition is called, even before they're diagnosed with diabetes. Because that high blood sugar actually damages the nerves, and that's what causes numbness, tingling, burning in the feet. And persons can they don't feel so well, so they can end up with cuts and scratches and actually puncture wounds because they didn't feel when they got cut. And then they end up with a wound that can get infected and can actually lead to an amputation. So neuropathy is the factor that most often increases the risk of diabetic foot complications, because if persons do not feel, that is when they end up with ulcers and amputations. The second part of that coin is the circulation. And you jumped on the two big ones right away. The high blood sugar, again, can damage the blood vessels or clog those blood vessels, make them hard. So they don't function as well. So the blood flow down to the feet is decreased. And when that happens, again, they can end up, if they got a cut or a puncture or something like that, lack of blood flow can actually lead to ulcers and amputations. So we can see that those two factors are the big ones. And diabetes affects the feet in other ways too. I might as well mention them. One, it can actually cause deformities. the hamartomas, the bunions, that also increase pressure that can lead to ulcers. Then it also affects the sweating or how the feet functions. And so it affects a lot of times persons have very dry, cracked feet that can actually open, they can get ulcers, get infected. And so we can see that the diabetes can have an all-around effect on the feet. And then all of those factors lead to complications.
Interesting. Very interesting. Thank you so very much, Doctor. Dave, I'm going to turn it over to you.
Okay, thanks. So what we have a nurse Raming, and she's going to tell us also something about the Diabetes Association, Diabetic Association, some information she want to share. I attended my first meeting a couple of weeks ago. Oh, right. It's called a support group. So I attended and I was glad I went there. I was able to get educated by a dietitian. And so I am open to continue to learn as much as I want to. And if there are any questions anybody want to share, they can just put them in the chat or WhatsApp me at 433-6917, 433-6917, or type them in the chat. I noticed someone asked for a number, and I guess can you put the phone number in the chat? So nurse, you have a phone number, maybe you might tell it, and Jackie, you could just type the number in the chat as she tell it okay, so the number is, maybe you could type it for me, 828-4194. I'm hoping to say I'm talking about the support group number. That's 828-4194, or you can call any one of the government clinics, okay? And set up the appointment this week. But the number is, more information for the support group, Bahamas Diabetic Association, 828-4194. Any other information you need, if you don't get it on the show, my personal cell, 433-6917. WhatsApp me, call me after the show, and I'll be able to get the information for you. That's 433-6917. But Ms. Raman going to tell you more about the Diabetic Association, the support group, and she's going to share some information with you.
Yes. So, good afternoon. Yeah. So we at Bahamas Diabetic Association, we're located on Carmichael Road. That's in Gregory's Anglican Church Hall. We have an office there. And the Bahamas Diabetes Association, we are all about educating, counseling, advocating, and supporting persons living with diabetes and those who are at risk for diabetes. So we offer a number of sessions. We offer the second Tuesday in every month is our support group, which is at 6:30 p.m. held at the association face-to-face. On our third Tuesday in the month, we have our Zoom teaching by Zoom, and we have health professionals on various topics. And we're starting our wellness program on the 12th of March, 10 a.m. That's a Tuesday morning at the association. So it's a whole wellness program that we've put together with various topics. So please feel free to join and become members of the Diabetic Association. And as we be blessed, we will be passing on the blessings to you. Thank you.
Good afternoon again, Jackie. We have one of our students here from Barry University. We're going to do an interview with him. We're going to he's going to tell us a little bit about himself. And this is actually his second time with us. So we're going to have him do a quick interview.
Well, go right ahead, sir. Welcome to the Bahamas. Introduce yourself and tell us exactly what are you doing here in the Bahamas. Welcome once again.
Absolutely. Thank you for having us. We're very grateful to be here and given this opportunity to help everybody that has come to the clinic today. My name, first of all, is Andrew Sawiris. I'm a third-year podiatric medical student at Barry University School of Podiatric Medicine. This is my second time in the Bahamas with Dr. Mitchell and Barry leading the mission trip. And we're just here to help as many people as possible. We feel like we need to give back to the community that has, personally me, that has given me so much. So that's kind of why we're here. We definitely want to give back to the community for sure.
What have you been doing today?
So today I have been seeing patients who are just in for routine nail care. They come in, hey, we heard about this. We wanted to come check our feet. We wanted to make sure everything is okay. Some diabetic patients who have come in, they really want to figure out if they're, everything is okay with their feet, diabetes under control, their shoes are okay, all of these things that, we need to progressively take care of with the diabetic patients specifically.
Well, I mean, just talking about that, are there any home remedies? So based on your study, I see you're wearing boldly a Barry University shirt. So based on your studies and your interaction with your patients, are there any home remedies that you could recommend that might be useful? Someone can utilize to prevent or to assist someone with some with complications. So to prevent complications or to assist, either end.
Yeah, absolutely. The biggest and most crucial aspect for diabetic wound care or for diabetic patients in general is healthy food. If you don't eat a good balanced diet, and if you don't eat healthy food, it's going to be a lot tougher to take care of your diabetes, and you can do it a lot easier with less medications overall over the long term if you continually eat a healthy diet. That consists of fruits and vegetables, good quality meats, high protein diet. Obviously, ask your doctor if you have any medical conditions, whether to eat red meats and stuff like that. But high quality protein meats and low sugar food with high fiber will allow you to control your diabetes more, and in the long run, prevent preventable ulcers, amputations, diseases that could otherwise lead to death, honestly. So
what, in terms of just talking about that diet, so I heard you said about protein. You didn't just say protein, you put an adjective before that. You define good protein. In terms of food mixture, is there certain foods that should be eaten? Okay, so you have your meal, should you be eating your salad to neutralize your starch? What about that? Is there any merit to doing that?
Yeah, absolutely. So foods that have sugar, so like fruits, for example. Fruits are a really good or really high source of sugar. However, some fruits have a really high source of fiber too. The fiber counteracts the sugar and allows your liver and your body to metabolize it a lot slower. So you're not releasing, that burst of insulin to counteract the sugar, but you're actually utilizing that sugar in a really healthy way. So, healthy fruits, meats, like you said, good, healthy, protein-rich meats with lower content of fat, then that will actually be better for you to eat higher quantities of protein with less starch. Obviously, with good fruits and vegetables that have a high amount of fiber in them, will limit your sugar, your low sugar consumption, and ultimately will help with your diabetes.
Now that we have you here, what about water? You're getting me all interested now, sir. So let's just comment in terms of the impact of water intake.
Yeah, absolutely. So water, obviously, we all don't get enough water. I'll tell you that. We need to drink more water. We need to drink at least 8 ounces of water a day, a glass of water a day. That's just minimum, purely minimum. You need to drink as much water as possible just to keep your body moving. Your body's made out of 60 to 70% water. You need to constantly be hydrating and keeping your body active, especially because we live in an environment where you're sweating, it's hot. You're going to be losing a lot of that water. And when you lose water, you lose the minerals, you get dehydrated, you start experiencing headaches, you start experiencing nausea, all of the signs and symptoms of dehydration. So water is a very, very essential part of your daily diet. So
thank you so very much. Back over to you, Dave.
Jack.
Go right ahead, Dr. Monique. Go right ahead, Dr. Monique.
Trying to work it out.
Yes, get right back in there.
All right. So one of the questions you asked about what diabetics can do, what they can do to protect their feet. The most important thing is to observe their feet every day. Look at that foot. It's not high tech, but it has to be done every single day to make sure that there's no problem. And if there is a problem, to identify it early and to seek help early. So persons can look on the bottom of the foot, the top of the foot, between the toenail, between the toes, around the toenails. Just look at the feet every day. And if you look at your feet every day, you will learn your feet. You will learn how it is. And when anything changes, you will identify it right away. So looking at the feet is critically important. The second thing is shoes, the type of shoes you wear. Wearing ill-fitting shoes or shoes that do not fit properly is the number one cause of injury to the foot. The number one cause. And so persons need to wear the correct size. Don't buy an 8 if you know you wear a 9. You know, you wear a 10 and then you buy 9 for comfort. Don't do that. You need to wear the correct size shoe, because if you wear the wrong size, it can actually cause you to cause blisters and cuts on your feet that can actually be really, really bad and can lead to ulcers and amputations. So those two things, the shoes, making sure they're properly fitting and for the right activity. So you're not gonna go to walking on in the beach or walking for exercise in a high heel shoe or a flip flop. You're gonna wear a tennis because that's the correct type of shoe that you need for that activity. A lot of times persons get injury because they're wearing the wrong shoe for the wrong activity. And so we want to encourage persons to make sure that you're wearing the right type of shoes. We also recommend diabetic shoes for persons with diabetes, especially if they have deformities. If you have hammer toes and bunions and stuff like that, diabetic shoes are specially made to accommodate those deformities. It actually are a little bit wider and a little bit deeper, and so they actually can fit the foot properly, and so that you don't cause any injury to the foot. So we want to make sure encourage persons to be able to wear the correct type of shoes.
That's very practical advice. I love those two. Go ahead. I see you're ready to
Yeah.
get in there. Nurse.
Yes, I'm gonna add to it too. And if you don't, even if you're not a diabetic, we need to love our feet. So wear wide width shoes. Go up a size in your shoes for support. You want to encourage the blood to flow down into your feet and learn to massage your feet. Learn to really love them. All your legs from below the knee. Massage your feet, lotion them up, and check, assess them at the same time. And another thing to do is to learn to, even if you buy the padding for the shoes, okay, put the padding in your shoe. But you need to wear proper shoes and not tight shoes rubbing onto the friction, causing friction. And when you go to have to clip your toenails, it's a proper way to clip those toenails too. And diabetics, a lot of people, sometimes you go for pedicure and they end up shaving off too much. Okay, calluses and stuff. It need to be done properly by a trained person. And make sure a person sterilize. Make sure they sterilize those equipments they use from foot to foot. All of that could cause infection, risk to the feet for injuries, and then you don't heal well. Next minute you're losing toes, or you go downhill. So you have to be careful on where you go and what are you doing with your feet. Make sure you dry your feet properly too. Dry between the toes. Really, really love the feet. No tight socks, no tight shoes. Thank you.
Okay, we have one of our platinum sponsors here for the Foot Fest, and we're gonna have an interview with her now.
Hello, everyone. My name is Riley Cernico with
Yes.
Darko International. Very excited to be here with you all.
Where are you from?
I am from Charleston, South Carolina, United States, and flew all the way in to the Bahamas for this. We also have one of our colleagues from the United Kingdom who has flown in as well to be a part of this event. This is really, really important for industry to partner with education and with government, because we are the solution together to be able to improve the state of healthcare. I'm so excited and proud to be a part of this amazing team, and really happy to get to meet everyone here and network in the Bahamas.
What do you do? How in terms of partnership? Is there something you provide while you're here?
Yes. So our company has donated about 2 pallets worth of boots and shoes that are used after treating surgeries.
Okay.
So we are very happy to be a proud sponsor of those products. We're also supporting marketing efforts to make sure that this year's program and future programs have the support they need to expand and continue. So we're very happy to support on both product and marketing fronts.
Big thank you on behalf of the Bahamian people. Glad to have you once again in the Bahamas. And Monica, I'm putting in a plug. Make sure you return next year. So that's futuristic.
With weather like this, it's no problem to come back.
Monica, you owe me for that one. But thank you so much. On a serious note, we really appreciate your contribution to the Bahamas and to such a noble cause. I know Monique, along with a team, Dr. Monique, along with a team, very passionate. She's been on the air sounding the alarm free of charge on many Sundays. To the people of the Bahamas, expressing her love and concern. So it's not, she's not in it, people. Yes, pay her please when you do go to her clinic. But I can tell you from experience, she's all about the people. But don't take advantage of her niceties and quote. Make sure, you know, on another level, when you go to her practice, she's top notch. So yes, give her the support financially also for her service. But thank you so very much. And once again, over to you, Dave.
All right. Thank you so much, too.
Yes, ladies and gentlemen, we just want to let you know we're broadcasting live from the Family Medical Foot Center. That's here, right here in Gardner, number 1, right next to the church. And this is Diabetes Check Your Feet Day. I have had mine checked, and it's absolutely free for those of you who are just joining us. Those of you who will be watching this later, whether it's Facebook, Zoom, YouTube, or however, we're inviting you to, in the Bahamas, you can go to your clinic in Nassau this week, make the appointment, and have the feet examined. And even if you have not been diagnosed with diabetes, the foot examination is still absolutely free. They will be coming to Freeport Wednesday. And so I guess next time they try to reach some of the other family of islands. But for those of you in New Providence, get the word out, let the folks know, go down, make the appointment, and get the word out to have your foot examined. There's so many persons here at the clinic today. I met quite a number of persons here. I was able to have my feet examined also, and there's still persons coming. They're not taking any new persons, okay? Only those who would have had an appointment because they were actually here from 12 o'clock today, 12 noon today. So they're gonna get 1 or 2 more persons to talk, to interview. In terms of, I'm hoping I can get an interview from someone who's here, a patient like myself. Until then, I'm gonna allow the nurse and our guest from, what is this, DACO? I'm going to allow them to talk for another 5-10 minutes. And then if there's 1 or 2 questions, we can maybe open it up. Let me look, see if, there's no question on the chat. So I'm going to allow the nurse, and then she can maybe allow our guest from DACO to share for a few minutes.
Yes, I'm just so happy to meet Ms. Riley from DACO because Dr. Mitchell gave so much diabetic shoes free to the Bahamian people.
Right.
So I could just send my diabetic members right here and get free shoes. And she's been doing this, I think, like 2 years now.
Okay.
You sent some shoes over?
For DARPA, this is our first year.
Okay, but some free diabetic shoes were here, and she was able to bless us. So we want a partnership, whatever the Diabetic Association, whatever we can do to assist. We're here to partnership because we all here for one cause.
Right.
And the Bahamas ain't just Nassau, we have the Family Islands.
That's correct.
So we want to, one of the goals of the Bahamas Diabetic Association is to have a link, a branch on every island.
Yes.
So yes, we are in need of funding. However, one day at a time, one step at a time, and with the assistance from the government, from Ministry of Health, and partnerships, we are here to bless others. So
we talking diabetes, looking at these biscuits now. Before it, boy, I would have been looking for some of these biscuits, but I got not into temptation,
Yeah.
These are my favorite ones. So let's have our friend share this for a few minutes before I just ask if anybody have any questions before we sign off. You're 15 more minutes ago. Just tell us a little bit of the company. Why did you decide to partner? I don't know. Do you love doing this? Just talk to us.
Yes, so Darko International was actually founded in 1985 by a podiatrist.
Okay.
And Dr. Darby, who founded the company, believed that it was so important for his employees to stay connected with the world.
Right.
So while we were headquartered in the United States, it was our mission as a company to do what we can to support the people all around the world. And when Dr. Hill, who is one of the lead coordinators for this from Barry University, reached out to Darko asking to be a sponsor, we absolutely said yes, because this is well within our mission and our corporate goals to make sure that we are doing what we can to support the worldwide global foot and ankle community. And this is such a great experience for Darko, our employees from the United Kingdom, as well as the United States,
yes,
to come to the Bahamas and actually get to meet the wonderful people of the Bahamas, to shake their hands, to learn from them, and to grow with them. So this is a learning opportunity for us as much as it is an opportunity for us to support the local Bahamian community. So this has really been an exciting trip, and it's only the first day.
Oh, wow. Yes. I'm sure she can enjoy the Bahamas.
Yes.
Oh, yeah. Yeah, she can enjoy the Bahamas. Oh, yeah. So what I want to do for these last few minutes, if there's anybody have a question that you want to open up in the Zoom and just ask any of the Nurse Raming is here now. Any question that somebody would want? Go ahead.
Hi, Dave. I placed a question in the chat.
Oh.
Yeah, so what advancements have been made in diabetic foot care and treatment? What advances? Advancements,
Okay.
sorry.
All right, any of you want to do that? What advancement has been made in diabetic foot care and treatment? Any of you want to tell me that, or that's something the doctor has to talk with?
Well, the doctor could elaborate more on that.
Okay.
But the main thing is with diabetes is education.
Okay.
So we've been lacking educating. So the government been providing a lot of free machines. And so with education, we want to teach you how to manage 90% of persons are type 2 diabetic, 10% type 1, but we can control it. Better controlling, and type 2 is reversible. And that's the main thing. If we could get you to realize the life changes, programs, wellness programs, we can improve. So that's the main thing. Prevention is better than cure, and that's why we're about educating.
Okay, and we have a doctor in the house, so she's going to be able to, she can ask that question. Somebody just put a question in the chat, and the doctor's the right one. What advancements have been made in diabetic foot care and treatment? What advancement has been made?
Introduce yourself, please.
Hi, how are you? I'm not sure where we're at here, but my name is Dr. Jacqueline Brill. I'm a faculty member at Barry University. I'm a foot and ankle surgeon here with Dr. Mitchell. I actually was Dr. Mitchell's residency director back in 2008. That tells you how old we are. So I'll tell you, just as I heard the other young lady speaking, I think one of the biggest advances in the care of diabetic patients is the fact that we have come a long way in learning about the pathology overall. And we realize how important prevention is and how important diabetic education is. I always tell my students one of their most important jobs when they're evaluating a patient is simply educating that patient about the disease process in ways that the patient can become a very proactive part of their medical care, evaluating their foot every day, making sure that they see a podiatrist on a regular basis, as well as other doctors from other specialties, because we know diabetes affects, multiple organ systems. It's so important. There have been a lot of advancements in regards to the different types of screening programs that are available to really help prevent the ill consequence of diabetic ulcers, infections, and unfortunately amputations. And that's really the role of the podiatrist is really helping patients keep their limbs. So limb preservation is really our main focus. And
how you been? All right. You know, I
Oh, wait, there's a question.
I brought this.
Pastor Clement, you have to mute your mic. Okay, because we have 10 more minutes left, Dr. Mitchell.
Yeah. Good afternoon again. I would just like to ask Dr. Brill to tell us a little bit about her role here, as she's one of our surgeons who will be doing our cases tomorrow and Monday. We're having persons here who are being evaluated for surgery, and they are being seen and evaluated to have their bunions fixed, hammer toes fixed, diabetic foot fixed. So we're going to ask Dr. Brill about that. Tell us a little bit more about that.
So, I think my role, if you want me to explain what my role is here today, I think as one of the surgeons that's going to be performing surgery over the next couple of days, is really to look at these patients oftentimes as a secondary consultation, just making sure that they are truly candidates for the procedures. Something just popped up here. I'm not sure.
Okay.
Okay. And some of them are being evaluated for the first time today. So, looking at the patient full body, taking their complete medical history, making sure that they are actually good candidates for the surgical procedure that was maybe already proposed, or one that we're proposing while they're being evaluated here for the first time. The last thing that we want to do is to put a patient through surgery that may not be in the person's best interest at this particular time in their life. We don't want to do any harm, obviously, to anybody. We're here to hopefully improve their current situation and hopefully prevent possibly future problems down the road. So that's really what we're doing today here in the clinic, is just evaluating some patients for the first time, some just confirming what has already been discussed with the patient, and making sure that we treat the patient full body and we're not doing any harm to anybody, and we're only doing good. All right.
After 2 in the afternoon.
Well, Dave and Jackie, we just want to say thank you so much for having us on the show
we
today.
have one more question, Dr. Mitchell.
Go ahead.
I think there's, Dave, you there? I think there's one more question in the chat. I know a lot of the Bahamians are afraid of needles, right? So in terms, is there the only way to identify whether someone has diabetes is to be pricked? Are there other methods utilized, or one must be pricked for that assessment to be made?
Yeah, so, most persons are monitored. There's monitoring for diabetes, and we highly recommend that, because we need to know where persons their blood sugar is, their levels are. And nowadays there are so many advances. You can use small lancets. Those are the little things that they do to prick their finger with, and they're virtually pain-free. And we have those now that are very, very easy, that persons don't have to really hurt or have a lot of pain. But then we also have continuous glucose monitoring as well, where persons, there's something that stays in the arm that allows them to monitor their blood sugar continuously. They don't have to actually prick themselves every day, but they can actually do it, and so that they don't have to feel it. And I am confident. I feel that in the future, very soon, we will have it where persons will not have to do finger sticks at all, because the research is advancing so quickly. There'll be other methods, I feel, of being able to monitor their blood glucose. But Jackie, it's not a difficult thing to do a finger prick and to check the sugar, and it's so critically important for the management of the diabetes. So we don't want people to focus on that little finger stick. It's just so important, that information that you get about your blood sugar. It helps you to manage your diabetes, to protect yourself from complications, prevent ulcers and amputations and blindness and kidney failure and all these things. because knowledge is power. So if you know what your blood sugar is, you know eating that second piece of cake was not a good idea, or drinking that soda was not a good idea, because that information, that sugar tells you that doing that actually causes your blood sugar to go too high. So it's all about monitoring and education. And so that is what we want persons to know, that knowing their blood sugar is good for them to be able to make the best decision.
But the slogan is
Thanks so
saying,
much.
it's in the blood, it's in the blood. So you don't want no one to guess on you, right? You don't want no one to guess on you. So the only way for you to know is to test. You have to start the testing through fasting first thing in the morning. You want to know where you started. So you want to monitor, and based on that, you know if you could cheat or not, eh? But if you're a type 1 and you're on insulin, it's very important for you to check your blood glucose before you take the insulin, but you may or may not need it at that time. If your sugar's already low, you below 70, and you take the insulin without checking, you can go into a coma. So it's very important to monitor your blood glucose. Before you take insulin, you're to check your blood glucose and based on the reading. So you have to monitor your diabetes. Everybody's different. And there's proper way of storing your medication, what to eat. We do all of this teaching and training. We have a wellness program beginning on March the 12th at St. Gregory's Anglican Church Hall, Tuesday morning at 10 a.m. Come and be a part. It's free. Come and be trained how to manage your condition. It's your diabetes, and you have to control it. Okay, so you have to make up your mind that mindset have to be where you want to improve your health. Nobody else health is yours. Okay.
Could you mention the date again, please? March 12th.
March 12th. That's Tuesday, March 12th at 10 a.m. We're going to start the wellness program. We have a whole list of it, and at the end of it, if you complete it, we're going to give you a certificate. Okay, so it gives you some layperson's training. And we have our diabetic educators to teach you these stuff. Okay, we have certified diabetics educators willing to assist you. And we have physicians who already volunteer to be a part. So come and be a part. Join the Diabetic Association. Thank you.
Okay, Dave, I know we're getting close to the end, so I would just like to reiterate the rest of the Foot Fest for the rest of the week. And then I would also like to recognize our fantastic sponsors. So the Foot Fest continues. Today is the 3rd, so we're almost done of day 1. But it continues for the rest of the week, starting tomorrow, the 4th through the 8th. We'll be having clinics continuing at our government clinics, 4 of them. South Beach from 12 to 5. Elizabeth Estate from 2 to 6:30, Fleming Street from 1 till 6, and Flamingo Gardens from 2 to 6. That's every day next week. And so persons can just call any of those government clinics to get an appointment. We recommend an appointment, but all persons will be seen. We will not turn persons away if they walk in. So persons, we are recommending, if you have any foot condition and you need to be seen, we recommend that you go to one of those sites at those times. We'd like to just take the time to recognize our sponsors, because we will not be able to do this without our sponsors. And you met our sponsor from DACO already, and we're very pleased that they are here. They not only sent us surgical shoes and other foot products. They did not do that. They came. 2 of them actually came with the team, and we want to commend them for that, because that is awesome. We also have another additional sponsors, international sponsors like Omeza and BioStem, BACO, and of course our Barry University School of Podiatric Medicine, with whom this could not have been done. And so we just want to say thank you, a special thank you to them. We also have the Podiatry Institute and Aurora. These are all companies who donated wound care products and different supplies to the clinics. And I must tell you, if you come to any of our clinics, you'll see that we have the staff as well as the supplies are all donated. by these companies. And so we're very, very pleased that they have taken the time and the commitment to do this over and over. This is actually the third year. I want to recognize some of our local sponsors. And so we have here Foot and Ankle International and Family Foot Center. These are two podiatry offices that we're closed our offices and open it up to have free clinics for our Bahamian people. We know that we have a shortage of podiatrists in the country, as there are only 4, and then we only have 1 that works part-time in the government system. So access to services may be very difficult for some persons and may be costly for others. And so it may not be, a person may not be able to afford it. So we wanted to commit and make sure that persons are able to provide to get those services. We have other sponsors. For example, we have Adventist Health Professionals Association, the Diabetic Association, and the Association of Diabetes Educators. You just heard from Nurse Rami. She's a rock star. And so we're very, very happy that she's here. And she's been with us all week. So we're very, very happy for that. We have some medical supply companies like Ports International, Bahamas Medical and Surgical, and NASA agencies who are very supportive, and they've given supplies that are also being used for not only the clinics, but also for training. We are going to be training our nurses to better take care of diabetic foot so we can prevent ulcers and amputations. The Public Hospitals Authority is actually on board with us because they're allowing us to use their facility for all the training, as well as making sure that our nurses are aware of what they need to do. I left for last but not least, Spectrum Health Center or Spectrum Surgery Center, because it is so fantastic. We are going to be doing surgery for 2 days, Tuesday, Monday, and Tuesday. And so these both sites, Spectrum Surgery Center and Foot and Ankle International, have provided 3 days, 2 days free for us to be able to do surgeries, free surgeries on these persons who sign up. And so we just want to say a special thank you to them. Spectrum, I can say months ago, they were excited to be on board with us. So just want to say thank you to all of them, because we could not have done it without them.
Thank you. I'm glad you got it with 5. You got it right on the dot. Over to you.
Yeah,
I'm glad you got it in. Over to you, the one and only David Williams.
So, any final words, Jackie, just before we sign off? Any final words?
My final word is Bahamian. Let's take advantage of the golden opportunities that await us. Please, let's do this and do it together. Thank you so much to all who have contributed to such a effort.
Thank you. You've been listening to the program Transforming Lives on Global 99.5, Cable TV 975. 1 minute.
Jackie, I forgot one of the biggest sponsors, partners, the Ministry of Health and Barry University. So we know that those two, without them, this would not be a reality. So I want to say kudos to the Minister of Health, Mr. Tavel, the Permanent Secretary, and the whole team at the Ministry of Health, because honestly, they are rock stars. They came on board and made sure that this is a success. So thank you to Barry, and thank you to the Ministry of Health and Wellness.
Transforming Lives on Global 99.5. We're here every Sunday, 4 to 5, encouraging you to have a wonderful day. Dave Williams, Jackie Gardner, same time, same station. Have a wonderful day.
Bye, everyone.
Thank you, Dave. Thank you, Dave. My apologies for.
Yeah, no problem, man. No problem. You know, time is go. We off the air now, so you can always interact on Zoom.
With my other business friend, she's got.
Yeah. I had a difficulty with turning. In fact, even sticking with the program, I would love to know when he's coming to Lutra. You know, I was saying I would love to know when he's coming to Lutra. I was saying I love to. I was saying I wanted to know. Any idea when they coming to Lutra? 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 Dave. Dave. David. Dave. 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 Any idea when they coming to Lutra? Praise to the Lord is worthy to be praised. How's Queen Vashti? Yes. Yes, Queen Vashti, what you saying? What you saying? I'm hearing you. Are you hearing me? I am hearing you. Are you hearing me? Praise the Lord. How is Vashti? How is Vashti? How is Vashti? Wow. I don't know what's going on. I don't know. I can hear you. Can you hear me? I could hear you.